This is Haystack TV, powered by HaystackHelp.com. Finding reliable services can be like finding a needle in a haystack. With HaystackHelp.com, finding the needle just got a lot easier.
Now, here's your host of Haystack TV.
Hi, everybody. I'm Mark McIntosh. Recently, the Wall Street Journal reported that over 16% of Americans suffer from chronic headaches and another 15% have chronic neck pain. More than 45 million Americans suffer from headaches and migraines. How can looking inside your mouth make a difference? Dr. Charles Barrett with Barrett's Dental joins us now. Good to see you again.
Good to see you, Mark.
And I tell you, tell us about the correlation between the two.
Well, Mark, what is overlooked by most caregivers is that almost all of these headaches have a dental component and all involve the same nerves as the teeth. So an imbalance in the way the teeth come together can trigger these headaches, but it's not as simple as that. There's usually a history of trauma or something else that causes these problems. TruDenta therapy is the only therapy that combines the best of sports medicine, muscle manipulation, and the dental component to provide relief for these problems as opposed to just dealing with the symptoms. And in Colorado, TruDenta is currently only available at Barrett's Dental's new division, the Denver Headache Center.
You know, we have a short video testimonial from a patient who was suffering from long-term chronic headache pain that was resolved with TruDenta therapy.
So about a year ago, I noticed that I was having some pretty severe pain in the jaw area. And then it wasn't until about 6 months later that I got really severe, to the point where I would talk and it was just so painful that I didn't want to talk anymore. It would give me probably about a headache every day, and I would take probably about 8 ibuprofen a day, and it would help a little bit, and then it would just come back. And then to even like eat something like soft like chicken or anything like that, it was just so hard to chew. Like it was just hard. And then I started coming here, and I noticed a huge difference. It wasn't until, after maybe 2 treatments, it felt really nice, and I wouldn't have the headaches anymore, maybe once in a blue moon. And then one day I was driving, I was like, oh my gosh, I haven't had a headache in forever, and my jaw isn't hurting, and it's just helped so much.
Dr. Barrett, why are so many sufferers confused about where they can find some help?
Well, Mark, let me tell you about my own experience. I recently suffered from my first migraine and knew that there was a dental component involved. By dealing with that, I got amazing results, but it occurred to me that the general public would not have had a clue about this. That's when I decided to get involved with TruDenta therapy. Sufferers often visit several doctors without results, and many of them are being prescribed drugs that only mask the pain. Some doctors, however, have discovered that TruDenta could help their patients. These doctors are now referring many patients to dentists like myself who provide TruDenta therapy. Treatable symptoms are chronic headaches and migraines, TMJ, head, neck, face, and jaw pain, vertigo, tinnitus, and a limited range of motion of the jaw, head, or neck. Most patients can be helped, certainly not all of them, but the vast majority.
All right, so Dr. Barrett, what could have caused all these symptoms?
Well, usually you can trace these symptoms to trauma of some kind. The majority of patients suffering from these symptoms have never considered that their issues could be related to their dentition and the supporting muscles. In reality, the majority are. With a comprehensive screening process and painless exam, my team can quickly determine if you could benefit from the TruDenta system of care. Both the exam and treatment are pain-free and require absolutely no drugs, needles, or surgery. I'm happy to tell you that over 95% of these patients have positive outcomes from the TruDenta therapy. And that makes a striking difference in the everyday lives of those who've been missing work, missing time with friends and family, and maybe experiencing depression as a result.
You know, it's amazing. Here we thought all these times that migraines start in the head, but they could be starting in your mouth.
Or the neck.
Or the neck. That's unbelievable. Thank you very much, buddy. We appreciate that. To find out if it can help you, the diagnostic process is quick and painless, and for a limited time, it's free. You have nothing to lose but your pain. You can have your life back. The Denver Headache Center is the only place in Denver offering this therapy. Headache sufferers can call Dr. Barrett's at Barrett's Dental right now to set up a free screening appointment, 303-532-1151, or visit them on the web at denverheadachecenter.com. The number one more time, 303-532-1151. Barrett's Dental sponsored this segment. 303-532-1151 or denverheadachecenter.com.